Very often it's not perceived that residents and the council always work closely together. Here is an example, an exemplary example, where neighbourhood plan is about residents working with officers and officers working with residents. And it's been significantly successful. This is about going out for consultation. I would urge members of the Cabinet to agree. It's very important this actually meets a much wider audience, and this is what this recommendation is all about. Thank you.
Councillor Hackwell, please.
Thank you, Councillor Chitty. I'm very happy to support this. As a member of the Planning Committee, this is a very good work by local people. That they've done an awful lot of work that's taken them years to actually complete these two neighbourhood plans. I think they're the first two neighbourhood plans we've had in Medway since it started, and both plans go into immense detail about their local area and the work they've done and what they'd like to see and how they'd like to see their area progress. So I'm more than happy to support this, that these go out for consultation, for a wider consultation. Thank you.
Any member? Back to you, Councillor Chitty.
Yes, thank you very much. It is important that it's recognised how hard the residents have worked. And how closely they've worked with the officers as well. This couldn't happen if there wasn't that type of working cooperation. So thank you for the support, and agree the recommendation that it goes out for consultation.
Thank you. Is that agreed? Agreed. Thank you. Item 5, Councillor Earls, please.
Thank you, Leader. I am pleased to introduce the Children and Young People's Plan to Cabinet today. This document supports collaborative partnership working to benefit the children and young people of Medway. It sets out our vision and priorities for the next 3 years. The plan is consistent with our people strategy, already agreed by Cabinet, and has been based on consultation with children, young people, carried out through the Child Friendly Medway initiative. Partners are currently working to a children's improvement plan overseen by the Improvement Board, which sets out how partners will work together to address the improvements needed in children's social care services and support a positive outcome from the next Ofsted inspection, anticipated to take place in spring, early summer 2023. The Children and Young People's Plan covers a period from 2023 to 2025 and will support a transition from the Improvement Plan, setting out refreshed objectives and priorities for all our children in Medway. This will provide meaningful direction to the staff delivering it and assurance to children and young people that we have considered and addressed the priorities they have identified through extensive consultation as part of our child-friendly Medway programme. Colleagues will note that the document outlines a vision and a set of shared strategic objectives, which are as follows. Children and young people will be safe. Children in Medway will have the best start in life. Children and young people in Medway will develop well. And children and young people in Medway will aspire to become independent and fulfilled adults. Children and young people in Medway will participate in and contribute to their community and have a meaningful say in decisions and services that shape their lives. Actions to support the implementation are identified and a set of measures will be in place to support oversight and evaluation of impact of the plan. These are consistent with those in the People's Strategy. The plan will be implemented with partners from April 2023, with progress reported to Health and Wellbeing Boards through the life of the plan. We expect the impact of the plan to be positive outcomes, including health, education, safety and wellbeing for children and young people and families as a result of the interventions that we provide. More children and young people being empowered and enabled to have a say in how services are developed and delivered, and more young people able to live fulfilled and independent lives in Medway, accessing accommodation, education and employment opportunities. This plan will support us to work closely with partners and ensure our resources are used efficiently and effectively and are focused on promoting better outcomes for children and young people in Medway. As per the recommendations of this paper outlined in section 13, I ask Cabinet is asked to note the comments made by the Health and Wellbeing Board meeting and the Children and Young People Overview and Scrutiny Committee as set out at sections 5 and 6 of the report. And 13.2, the Cabinet is asked to approve the Children and Young People's Plan attached Appendix 1 to the report. Thank you.
Thank you. Councillor Potter.
Yeah, thank you, Leader. Very happy to second this item. This is very much an umbrella plan that links in with what we're doing across children's and education. I think the work of Child-Friendly Medway to engage the voice of the child and help shape this report has been very important, and that work is ongoing. And I think as we develop the Child-Friendly Medway programme, we will only strengthen our work in that area and hear more of the voice of the child in Medway. Partnership working is a real key element of this plan and in much of what we do. And as colleagues would know, we've worked with schools and academies over a number of years to put in structures and initiatives in place to strengthen that work and co-production with our schools and academies. The Medway Education Partnership, we founded the Medway Education Leaders Association back in 2017, working with our primary school leaders. We work closely with the Medway secondary heads, and of course there's the work with the statutory bodies, the regional director, and of course the Department for Education. So all of this ties in with that work that we are doing, and I'm very pleased and proud to say that we have over 90% of our schools in Medway now good and outstanding. I think the best place, or certainly one of the best measures that we've had in that area since the formation of the local authority. And of course there's a lot of ongoing work as we recover from COVID and get back to where we were back in 2019 and progress from there. Thank you, Leader.
Remember, Councillor Brake.
Thank you, Leader, and Councillor Isles for the report. As is noted in the recommendations, mention is made of the fact that the Cabinet was asked to note the comments made by the Health and Wellbeing Board together with the Children's O&S committee meeting. But just to pick up on the Health and Wellbeing Board, all the details are given within the report on page 217. But what is interesting to note is that the board was informed that whilst there was no statutory requirement for a plan, it was decided that it was necessary given the improvements and transformation journey that was being undertaken in the service. That too, the Health and Wellbeing Board was considered a very important factor in our considerations. But interesting to note that members made a number of comments, but the one that really caught my eye, not only on the day, but is in the report, and that was that asked how to ensure that the voices of all children in Medway were consulted as part of the plan, and the role service had in this. The Director of People said that the Child Friendly Medway initiative played a major role in capturing the voice of children and young people. Schools also played an instrumental part in capturing the diverse views of children. I believe that really encompasses all that we're talking about within this report, and it's good to see that these remarks are included within the body of the report. Leader, I have no qualms in accepting the recommendations as laid out, and will be fully supportive of the report. Thank you, Leader.
A couple of comments from me, if I might, following on from what was said about child-friendly Medway. Quite clearly, there's a great deal more to this plan than child-friendly Medway, but it does, that programme which we started a couple of years ago, which the Conservatives passed through full council, as you remember, at the budget meeting at the time, dovetails nicely with the wider work that's going on with children and young people. And I think the fact that we constructed Child Friendly Medway as a corporate initiative rather than one that was devolved to the Directorate, I think is important and is one of the reasons why the programme, I think, has been so successful to date, because it is becoming embedded across the corporate whole of the council, and it's important to realise that children, young people are central to what we're doing here in Medway. They're central to this administration's commitment to the people of Medway, and I think that that's demonstrated quite clearly there. On Councillor Potter, your point about good and outstanding schools, we have managed ourselves into a very strong position vis-à-vis that. I just want to touch very briefly on our commitment to selective education. The breadth and strength of our grammar schools is something to be really proud of here in Medway. It's a central plank of this administration's ethos. It's one of our central commitments to the people of Medway to continue to provide a strong selective system open to all, and that has gone and will go from strength to strength, so I applaud that approach, and that's as part of what we're doing for children and young people. Councillor Isles.
Yes, I'd like to thank colleagues for their comments. In terms of, and I'm going to reference to the Director's comments regarding the assurance on families following the unfortunate and tragic news of death of the child in Rochdale. We do have we have actually strived and achieved, I believe, a very good working partnership relationship with the housing department, so we are covering that, of course, in terms of housing. Couple of comments, reference to 6.3, I would support a Children and Young People's Partnership Board to support that partnership working. I think that is very important. And also in terms of inclusion regarding SEND under that section, I met with the Child Friendly Medway team because I had some concerns that were raised regarding the inclusion of SEND children, i.e. the participation in events, and I was assured that it is very much inclusive, and their needs and requirements are taken into account for them to attend those events. So I was quite assured by that. But during the conversations that I had with the team, the work that they have done and will continue to do is phenomenal, and it's a really great initiative, and we've got some very dedicated staff carrying out all the work and putting on all the events for children and families to attend. So it is a very good pathway to get the concerns and views of children and their families. I would also say that contributions have been made from the corporate parenting board meetings, where we listen to the voice of those less fortunate children, the vulnerable children. So I think a great deal of work has been put into this plan, and I think it will be an extremely good plan going forward, and will expand on the work undertaken in the improvement plan. Thank you.
Is that agreed? Thank you. Agenda item 6, Councillor Isles.
Thank you, Leader. I am pleased to introduce Medway's Adoption Partnership RIAA annual report to the Cabinet today. Medway's regional adoption agency, the Adoption Partnership South East, is a regional adoption agency comprising of the London Borough of Bexley, Kent County Council and Medway Council. It launched on the 1st of November 2020 and delivers adoption services on behalf of the 3 local authorities. This report demonstrates the extensive work that has taken place through the RAA over the last year to ensure consistent and effective scrutiny of adoption practice and the impact that this has for Medway's children. The RAA is now becoming embedded. Partnerships are working very well with strong governance and quarterly board meetings which are attended and chaired by each of the local authorities' Directors of Children's Services. So far since April 2022, Medway have had 26 children with an adoption plan agreed. This is considerably better than 2021-22, when adoption performance had been impacted nationally by the COVID pandemic, which had resulted in delays in court proceedings. Although adoption timeliness in Medway is not yet back to pre-pandemic levels, court proceedings are now progressing and more children are moving through the adoption process in a timelier way. The RAA East has recently been successful in submitting 2 expressions of interest for DFE funding streams to support early permanence and the matching of children in our region. In August 2022, the RAA was subject to an independent review of its adoption support services undertaken by an independent consultant commissioned by the National RAA Leadership Group. The review found that RAA is strong and well led with committed and skilled staff, providing good support to children and families. A development plan and key priorities will be integrated into the business plan and progress reviewed by the RAA Governance Board. As per the recommendations of this paper, on page 253, the Cabinet is asked to note the comments from the Children and Young People Overview and Scrutiny Committee as set out at section 4 of the report. And 10.2, the Cabinet is asked to note the annual report as set out at Annex A. Thank you.
Thank you, Councillor Isles. Councillor Potter.
Yeah, thank you, Leader. So I have a bit of a history with the Regional Adoption Agency because back in, well, 7 years ago, when I first became a portfolio holder at my first cabinet meeting, in the absence of the lead member, I took forward the paper to establish a Regional Adoption Agency. And I also attended the launch a little while later, which was actually done online, and this was before we were all set up with Teams and all of that, and I remember it all being a bit chaotic, but it went well in the end once we got logged in and everything in Ian Sutherland's office. So I'm pleased to see that it is going from strength to strength, that we are recovering from COVID with the adoption numbers increasing. And I think the premise, this was obviously a government-led initiative, but I think the premise of a regional adoption agency is one that is well-founded, and I think if we, by working together across the wider region, we have that better opportunity to find everlasting homes for young people in care, and that's the right thing to do. So I'm very pleased to see that we are recovering from the COVID. Of course, we are fighting a trend where nationally, adoption numbers are going down. It's very difficult to find families to adopt children, but with the work we're doing here, I think we're best placed to get those outcomes for our children here in Medway.
Thank you, Councillor Potter. Councillor Chitty.
Thank you, Leader. Just a very brief comment, not only on this but the previous item as well. The portfolio holder has taken it very, very seriously, the importance of getting this right, and I know just how much dedication she has put into it. She's worked tirelessly to identify all the trials and tribulations, and she hasn't been daunted by it. In fact, she's proved to be very resilient in finding answers to very difficult problems, and I think it would be remiss of us if we didn't acknowledge that hard work. Thank you.
Yes, quite right. Thank you. Councillor Brake.
Thank you, Leader, and Councillor Isles for the report. A very in-depth piece of work, as Councillor Chitty has just mentioned. It covers so many areas. It's unbelievable, and you're to be congratulated together with the team on the presentation of such a report. One thing I would just like to bring to the fore is, in fact, the on page 249, paragraph 4.7, the support for adopters, which I think is a very important factor. There's much said in the report about the support for children and the family and how that all goes together. But of course, those that are actually coming forward to adopt young people, children, in fact, is a very important fact. Or part of the process which needs to be gone through with a great deal of consideration. And if I might add, please, that whilst it's several years now since I sat as a magistrate within Medway, I'm sure that my colleague Councillor Chambers, who also sat in similar circumstances, would agree that the family court, and in particular adoption of children, is probably one of the most rewarding parts of being a magistrate. Very seldom did we see young children old enough to understand what was going on in the court for adoption. Most of the time it was usually a babe in arms, but all the details would be given. But believe me, when a young person is in court who does have a grasp of what's going on, it just seems to make it all that much more worthwhile. And I think the approach by magistrates, I'm sure that many people in our community believe that the magistrates are in fact a rubber stamping exercise. What I'd like to point out that is far, far from the truth. The magistrates, certainly those in North Kent and Medway that I represented, certainly took adoptions very, very seriously indeed, and would read through the reports and raise questions as they thought appropriate, just to make sure that, if you like, an independent set of eyes were being put across the whole process of adoption. And I think it's a good audit process. It's a good process of making sure that the right child goes to the right people. And believe me, it's, as I say, it's probably one of the only parts of my service as a magistrate that would really bring a smile to somebody's face and sometimes a tear to somebody's eye. But well done, an excellent report. I fully commend it and have great pleasure in supporting you. Thank you, Councillor Isles and Leader.
Thank you. Councillor Isles, please.
Yes, thank you, colleagues, for your comments and kind words. Thank you. I don't really have any more to add to what I've already said, except that the adoption team work extremely hard and they have robust systems in place, which I think you can see illustrated in the report. I'm very pleased of the progress that they've made, and you know, the embedding of the system, and obviously for the children as well. So thank you very much.
Thank you. Is that agreed? Agreed. Thank you. Go to agenda item 7, and will members note that there is a supplementary agenda number 1 that goes with it. Councillor Galvin.
Thank you, Leader. This report covers the renewal of the CCTV partnership with Gravesham from April 2021 to April 2024. The reason for the delay is that the CCTV Partnership Board did not meet during the pandemic. The board is now meeting regularly and the agreement is ready for sign-off. I don't know that some people like to make a mischief out of CCTV matters. I would like to point out that Medway CCTV matters are dealt with at the Community Safety Partnership meetings, and the Community Safety Partnership did meet during the pandemic. This report purely covers the arrangement between Medway and Gravesham with the shared service. And I'm pleased also to report, Leader, that we have a good working relationship with Gravesham at both member and officer levels. Therefore, Leader, I'd like to move that Cabinet notes the report and approves the CCTV Partnership Agreement as set out as Appendix 1 to this report. Thank you, Leader.
Thank you. Councillor Hackwell.
Thank you, Leader. I totally support this, and it's good to hear that we're going to get the partnership board back on track and taking note of it. And the detail in the Appendix 1 clearly sets out how we move forward, and I'll be more than happy to agree with this. Thank you.
Thank you. Remember? Is that agreed? Agreed. Thank you. We go to agenda item 8. Councillor Brake, please.
Thank you, Leader. It is a statutory responsibility of local authorities to provide sexual health services comprising of both the GUM, that is the genitorial medicine, and sexual and reproductive health, SRH. When delivered as one service, this is known as an integrated sexual health service, and such services are funded from the ring-fenced public health grant and are overseen by the Director of Public Health. The ISHS delivers the following for young people and adults: services to prevent, detect and treat sexually transmitted infections, services to prevent unplanned pregnancy, clinical and outreach services to reduce barriers to access and stigmatisation, support and contributes to the wider health and wellbeing agenda. The current contract was awarded to Kent Community Health Foundation Trust, the KCHFT, after a competitive tender. The contract started in October 2016 and was a significant change on previous service provision where GUM and SRH were delivered separately from different locations. Since 2016, the service has been delivered from 4 Clover Street in Chatham as an integrated service. The service has matured and developed over the last 7 years. 4 Clover Street is leased by the council and is sublet to KCFHT. The premises have proved popular with staff and public alike. It will continue to be available to any incoming provider. Accessibility and innovative methods of service delivery has meant that Medway did not have some of the difficulties other areas had during and after the pandemic lockdown. Innovation has included online requesting of STI sample kits, web chat functions via provider website, telephone triage, remote consultation for long-acting reversible contraception, self-administered injection for contraception, online offering of condoms that are then delivered via the postal system, and rapid mobilisation in response to Mpox vaccination programme. Given the success of the current contract, there will be no significant changes proposed to the service model delivered, but competitive dialogue will enable us to enhance the existing innovation. Under the existing contract, HIV treatment services were commissioned under a Section 75 agreement with NHS England, but due to anticipated delegation of responsibility of HIV treatment to the Integrated Care Board, the ICB, it is not proposed Medway renew the Section 75. Discussion is taking place with National Health Services England commissioners to ensure that HIV services will still be delivered alongside the ISHS. As part of the procurement process, it has been hoped to make use of the nationally proposed provider selection regime, but this has not been finalised, and it is therefore not available to local authorities to use part of their procurement policy. A competitive dialogue has been recommended in the report, and this will give a clear picture as to the true market interest. It will involve existing provider in the process, should they choose to bid, and thereby enable them to reduce the disruption due to unknown aspects of the new services specification. Although tight, there is still sufficient time to procure the service based on the timeline produced by category management. The mobilisation period for the new provider would need to be closely managed to ensure it is achievable and is likely to require complex discussion between outgoing and incoming providers. The recommendations, Leader, are set out within the body of the report on page 355, item 9. Thank you, Leader.
Thank you, Councillor Brake. Councillor Dale.
Well, I'm very pleased to see that this is going through, because I think that the integration of service is extremely important, and I think this is another step towards that. But I think when you see the benefits that have resulted from an efficient service, things like being able to get to HIV, to detect it early, you know, to make sure that it is then do it when it's fixable rather than do it when it's you've really got to do an awful lot of pain and anguish to get rid of, you know, those things. And I think that's awful. You know, the other thing is I think that where we've got the reduction in under 18 conceptions, I think that's also very important, because I think there's nothing worse than someone feeling that they've got to have this child, or they don't want it because of the stage of life that they're there. And then, of course, that often is the beginning of all sorts of problems, particularly if they're in an unstable relationship and so on. And so it's better to try to educate people so they don't get into those sort of positions, and to help, you know, generally with what are very important parts of the social fabric, I think. So I'm very pleased to welcome this and heartily support it.
Councillor Hackwell.
Thank you, Leader. I'd just like to echo what Councillor Brake said right at the end of his speech, that if you look at the timetable for actually achieving this, is very, very tight, and the contract not being awarded till a couple of weeks before the current contract runs out. So I think we need to be very careful that we have very good project management of this procurement, especially in this election year, so that we actually make sure that we can hit the timescales on time. Thank you.
Back to you, Councillor Brake.
Thank you, Leader, and thank you, colleagues, for your comments. You're right, absolutely right, Councillor Hagwell. Project management is keen to all that we do here, and in fact, it takes me back to the days when we actually moved the service from MFT to Clover Street in Chatham. And believe me, that was probably one of the tightest projects I've ever seen run, given that we had to procure a lease on a property. We had to refurbish the property, bring it up to exactly what we needed for the service, because for reasons best known to Medway Hospital, they wanted the service out sooner rather than later, which put us under a great deal of stress at the time. But I'm pleased to say that the public health team and their contractors worked extremely well to deliver on time. So I'm quietly confident that the same will apply on this occasion. But thank you very much for those comments, and I move the recommendation as is outlined at paragraph 9 on page 355.
Thank you. Is that agreed? Colleagues, with regard to the urgent item, I recommend to Council to exclude the press and public during the consideration of the exempt report for the urgent item on the basis that the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Is that agreed?
Agreed.
Okay.